For many Filipinos, a health maintenance organization, or HMO, is not just a health plan, it's a lifeline, a fragile thread of hope that promises protection from the crushing weight of medical bills when illness strikes. But for countless families, this hope is painfully out of reach. The truth is, despite the life-saving benefits that HMOs offer, the cost is often too steep for those already struggling to survive. The daily fight to put food on the table, keep a roof overhead, and provide for loved ones leaves little room for anything else, much less health insurance. Workers in small businesses or informal jobs are left exposed, vulnerable to the terrifying reality of facing illness without any safety net. The pain runs deep when families are forced to empty their savings or plunge into debt just to cover basic medical care. The fear of sickness hangs over them like a dark cloud, and the dream of securing an HMO feels like a distant, unreachable star. And to help us understand the crucial importance of HMOs, health insurance, and the impact they can have, we are so honored to have with us tonight Camille, CEO and co-founder, alongside Jiawen Tang, president and also co-founder of Hive Health. Good evening, Camille, and good evening, Jiawen. Thank you so much for gracing us with your beautiful presences on Up Close tonight.
Thank you for inviting us.
Well, first of all, we all know that Hive Health is now revolutionizing the healthcare provision landscape. But I'd like to know how this started. I'd like to know, something personal. Did you guys come up with it because you're in the business? How did this all begin? Camille.
Yeah, I actually met Jiawen when we were grad school students. So we met and we realized that our dream was really to create a social enterprise that will really impact developing countries. And this Hive Health actually started out as our thesis when we were grad school students in Harvard, and we took a look at public health and realized that 56% of costs are out of pocket. Almost 2 million Filipinos go into poverty every year just because of health shocks. And took a really deep look at it from a research perspective and realized that, hey, we can build something at scale to make meaningful impact across Filipinos. And yeah, that was right in the middle of pandemic, and here we are today, early in the journey, but very much excited and bullish about the impact that we're able to make.
Wow, amazing story. You call yourself a full-stack digital tech insured company, insurer rather. What exactly do you mean by that? You talk about a digital platform streamlining the process of managing HMO plans, not just for employers, but those that are working for different businesses. Can you tell us more about that, Jiawen?
Yes, definitely. So Hive Health is the first digital health insurance company in the Philippines. And what that means is we provide value for money, comprehensive health plans for small, medium businesses, for their employees and their loved ones. And we do this in 3 different ways that are different from the current offering, as you said. The first is in terms of the expanded benefits. So not only do we have all the benefits of a typical HMO, like inpatient, outpatient, dental, but we also offer things like mental health and outpatient medicine that's not usually offered in HMO plans. So it's really expanding the benefits through our nationwide network. The second is, you mentioned the digital platform, so it's about the ease of use, both for patients and for HR managers to be able to add members to the plan. And then third is actually, well, we can talk more about this as we go. The third way we differentiate is we actually are bridging between virtual care to in-person care through our digital platform. So someone can go from a teleconsult to get referred to our 20,000 doctors and hospitals across the Philippines to really be able to have all their care journey through Hive Health.
Okay, may I ask right now, this is, how old is this company?
Actually, so we started in 2021.
Okay,
so I guess we're like
roughly 3 years old. Yes.
But last year we acquired almost like a then 37-year-old company, and they were the second oldest HMO in the Philippines. So they started this industry. So we're really, really lucky that we started as a tech platform to really streamline care, but now we're able to bridge this to a nationwide network of providers and really have this institutional knowledge and scale what we're building to much more Filipinos across the country.
Congratulations, that sounds amazing. And you also have an ironclad set of investors. What role do you think these top global investors play in shaping the continued revolutionizing of this platform? And as you said, you're always looking for ways to improve services because, the Filipino market is different. we are 110 million strong. And sad to say, the average Filipino family is just one hospital bill away from bankruptcy. So, top-notch investors are key.
Yeah, so actually this is very timely. We just announced this month our $6.5 million fundraise, and that's really important in terms of the confidence that top global and top local investors have for what we're building and for how impactful this is for Filipinos. And in terms of what importance they play in our mission, we don't see them mainly as capital partners. We see them as like partners from a bigger sense. They help us think of how to innovate both from a global and local perspective. And just to give you an idea of some of our investors, this includes Gentry, which is essentially a top local investor that's affiliated with the SM third generation C family. So they really help us look at the local market landscape. The second one is BNEX, a top global investor that has really launched something similar in a much larger scale across different countries like Nigeria, India, US, and other countries. A third example is Y Combinator, the Silicon Valley accelerator that started Uber, Airbnb, Dropbox. So we're really excited. And on top of that, we have angel investors that have really believed in the mission from day one. And this includes the CFO of Netflix, the founder of QualiMed, that's now part of the Healthway QualiMed network, and even the owner of the HMO that we bought, which is HPPI. So I think it means a lot of us for them to give us that confidence and give us this support. And we're really standing on the shoulder of giants to build this company and impact lives.
Wow, you have a full armory of investors. So I am very excited to see where Hive Health will go from here. But as far as the features that you are offering now and hope to offer in the future, as you know, there are a lot of companies that also offer say remote jobs or those that are also working in remote areas. I know that is also part of your mission. Jiawen, can you tell us a little bit about that?
Yeah, so right now our focus, as you said, is on SMEs. So we offer group health plans, and in the future we would love to be able to cover more and more people across the Philippines, including freelancers or individuals. And from day one, our mission has been around increasing, expanding access to healthcare, and we do that through the platform and enabling someone to make the process extremely hassle-free from the moment they become a Hive member to when they need care, and also make that really hassle-free and not needing to be a source of stress for HR to manage, to not have to deal with paperwork or manual spreadsheets to enroll their members, for members not even knowing what's covered, what's not covered. You mentioned a lot of people are just one hospital bill away from really being struck by poverty or being burdened by it. And so we want Hive Health to be a partner to all Filipinos and to really be a trusted partner that when you need us, we're there and you can trust us to be able to take care of you and your family.
Okay, down the line, I'm sure customer satisfaction, right? And feedback is important to you guys. How would you measure the impact of your services vis-a-vis employee well-being and overall, I would say, client and partnership satisfaction?
Yeah, I think we're very proud of this. We pretty much apply a very data approach. So we look at every single customer sentiment across the value chain of the services that we provide and take that immediately and incorporate it into our products. You'll hear from some of our accounts how they give a feedback last month and we already are able to ship a product to address that pain point. I think we're very proud of that, but on top of that, we're always listening. We do quarterly regular check-in feedback sessions with our accounts, and we see them actually as our partners. We're very grateful for the early customers that we have that really gave us into a lot of the insights to make healthcare hassle-free, not just for the employees, but also for the employers. But that's just the first step. Where we really want to go here, aside from bending the cost curve of health insurance and making it more accessible, more affordable, is changing healthcare outcomes. And that's where it gets really interesting because then we're able to manage care and work with providers to really, let's say, bring down diabetes through lifestyle measures and really pair our health insurance platform with incentives and our partners from the provider network to really change healthcare outcomes as well.
Okay, when you talk about changing healthcare outcomes, it's also important to continually redesign the inclusive dependent policies, as you mentioned, and comprehensive benefits. What criteria do you use? Do you have a research team? Are you constantly on the ground talking to your clients? How does that work?
Yeah, so I guess we are the OG research team, but it's very much, we do think about it in terms of actually 3 pillars of healthcare accessibility. So the first is making sure, how do we ensure that more and more people are covered? So people coverage. The second is services. Can we continuously cover more and more types of medical and healthcare services? And then third is financial coverage. For the people covered and the services we're covering, can we cover more and more so that they don't have to pay out of pocket? And so, as you mentioned, we offer coverage for dependents such as LGBTQ and other ways in which we are providing more preventive care. And these are, in the ways that we decide to do that is through this lens of people coverage, services covered, and financial coverage. And I think it's going to be an iterative process to continuously, hopefully, increase that coverage for everyone.
Great. So right now, what is next for Hive Health? I mean, you are now focusing more on SMEs and startups, like you said, focusing on making sure that it is affordable and comprehensive and inclusive. But at the moment, there are also a lot of individuals that have their own, I would say, practices. They're self-employed, they're freelancers, and as you mentioned, they're part of the unfortunate percentage of Filipinos that do not have health care. Are you planning to branch out to that market?
Yeah, I think when we started it, the North Star was always healthcare accessibility. Right now, our focus is SMEs, and it's actually amazing how we hear some of our patients who've never had an HMO before, but because the SME that typically doesn't provide an HMO decided that it was easy, let's get some employees' health plans, and it really changed their lives, especially when they get a health shock. But we're not stopping there. The dream is to make health insurance penetration and risk management for Filipinos, starting with Filipinos, like much more readily available. But for now, we mentioned the recent milestone on funding. We really plan to grow our mission-driven superstar team, branch out our extensive network that's already nationwide to even more remote parts of the country that are often overlooked, and build and invest in our product to really make the patient experience much better.
3 years down the line, how big is your network? How many hospitals, clinics, doctors are we talking about?
Yeah, so right now we have over 20,000 doctors. Actually, it's 20,000 doctors, over 1,700 hospitals and clinics, and that's actually at parity with the largest HMOs in the country. But that doesn't stop there. So it's both actually the quantity of providers. So hopefully we can get every provider out there to partner with Hive, and we provide really transparent processes and being able to process claims and pay out faster. But beyond just the quantity of providers in our network, we really care about making sure the quality that the care that they deliver is consistent and benefits our members as well. So we are always talking to our providers and thinking about ways in which, aligning our incentives with our suppliers and our providers to ultimately, as Camille mentioned, improve healthcare outcomes so that people can live healthier lives, stress-free from the financial burdens of healthcare.
Holistic, affordable, inclusive. Sounds like a massive winner. We'd like to thank you guys for joining us here today, and I wish you and Hive Health the best in your continued transformational journey. Thank you so much, Camille.
Thank you so much.
And thank you so much, Jiawen.
Thank you.
Thank you.